Misdiagnosis of cellulitis is common in all healthcare settings, including hospital, emergency departments, and outpatient clinics. The lack of a specific test for cellulitis and the large number of its mimics presumably accounts for its overdiagnosis. A few key points of this case are as follows. First, cellulitis is usually unilateral and acute. Conditions that are bilateral, chronic, or non-continuous should prompt consideration of alternative diagnoses. Although this patient's lower extremity edema was asymmetric at the initial visit, erythema was noted on both legs, which raises a suspicion for pseudocellulitis. Second, lack of response to antibiotics is often thought to be due to treatment failure, prompting a change in antimicrobial therapy, many times exposing patients to overly broad coverage. Often, however, it indicates misdiagnosis, meaning the patient does not in fact have cellulitis. Third, Clostridium difficile colitis is increasingly common in the outpatient setting. The most important risk factor is exposure to an antibiotic. Although all antibiotics have been associated with C. diff infection, 2 recent meta-analyses suggest exposure to fluoroquinolones, beta-lactam inhibitors like amoxicillin clavulinate, and clindamycin may confer additional risk. Fourth, beta hemolytic streptococcus, particularly strep pyogenes or group A strep, cause most cases of non-purulent cellulitis. Data suggests that this is also the case for diabetic patients in the absence of an open infected wound. Thus, most patients only require narrow-spectrum antibiotics with good streptococcal coverage and good oral bioavailability, including, for example, dicloxacillin or cephalexin. Fifth, historically, trimethoprim sulfamethoxazole, or TMP-sulfa, his activity against streptococcus has been questioned. However, a recent study demonstrated that TMP-sulfa and clindamycin perform similarly. Thus, adding a beta-lactam to TMP-sulfa for strep coverage is unnecessary. Anderson?
That's me.
It's very nice to meet you. I'm Dr. Long. How can I help you today?
Well, about 3 days ago, my right leg started turning this purplish red. I tried to see my primary care physician, but she was booked today.
Oh, I'm sorry you couldn't connect with your primary care doc, but I promise I'll take good care of you and communicate with your doctor for any follow-up visits. Does your leg hurt right now?
Well, a little bit, but they feel heavy.
Both of your legs?
Yeah, my right leg feels heavier than my left, though.
Okay. Does your leg seem swollen to you?
Oh, yeah.
And have you had any fevers or chills or sweats?
Well, I felt a little warm last night. I didn't take my temperature, though. Mostly, I just feel pretty run down.
Okay. Have you had anything like this before?
I had a similar episode last year. My doctor gave me antibiotics, and it went away after a few days of laying in bed. This time, it seems a lot more red.
Okay. Well, let's review your past medical history briefly so I can get to know you a little bit better. Do you have any other medical issues right now?
Well, I've got diabetes, but I take these pills for that. A couple of years ago, I had a heart attack, and now I take baby aspirin every day.
Oh, I'm sorry to hear you had a heart attack, but I'm glad you're on a good aspirin regimen. Is it okay if I take a look at your leg now?
Oh, yes, please.